Hello, and welcome to our May 2016 Discovery Series presentation. And of course, we're live streaming again from our home offices in Palo Alto, California. Very pleased to have all of you here with us tonight. I'm Sue Landgraf, Executive Director of Cystic Fibrosis Research Incorporated, fondly known as CFRI, and I'm very pleased to welcome our guests here in our audience and also online. We have an extremely special program for you tonight, but before getting started, I'd like to thank our sponsors, Vertex Pharmaceuticals, Genentech, and Chiesa USA for generously sponsoring tonight's event, because without them, we could not be here tonight. So thank you very, very much. And I know you probably get tired of this, and I share it with you every time, but it is so important. As always, we urge you to work together with your healthcare team. No information that you receive here tonight is intended for a patient's diagnosis or treatment, and that truly, truly is important. I would like to thank tonight's CFRI-Live team, David Suhu, Scott Wakefield, Mary Convento, and Siri Vaith Dunn. So they are helping to bring all of this information to you tonight. And believe it or not, this is happening in real time. And that is very exciting. So at the end of each of tonight's presentation, of which we have two, I encourage you to ask questions. Trust me, questions are always appreciated. It's a great opportunity for you to get your questions answered from experts in the field. So for those of you watching online, please click in the chat box on your screen and type in your questions. And at the end of each presentation, Mary will hand over your questions on your behalf. And please, I encourage you, do not be shy. So let's get started. Tonight's overarching presentation title is Be the Change, the Impact of CF Advocacy. As we know too well, cystic fibrosis is a devastating disease for which there is still no cure. We've had advances in medications and therapies, but we are always waiting for that cure. Because CF is considered a rare disease, impacting less than 200,000 people in the United States, the issues that face our community may not receive the attention nor the funding that they deserve. So I am thrilled to share CFRI's plans to change this through our new Advocacy and Awareness program, after which I will be honored to welcome Sherri Sager to the podium. Sherri is Chief Government Relations Officer at Lucile Packard Children's Hospital, Stanford, and she will share her advocacy experience, which she has extensive experience, and we cannot wait to welcome her to the stage. So I will kick things off and talk about CFRI's Many Voices, One Voice CF Advocacy and Awareness campaign. And I have to tell you, we are all very, very excited about this because it is something new for us. So here we go. Many Voices, One Voice, CF Advocacy and Awareness campaign. Before I jump straight into it, I want to revisit our mission. CFRI exists to fund research, to provide educational and personal support, and to spread awareness of cystic fibrosis, a life-threatening genetic disease. Now, I have to tell you that we have funded over $9 million in CF research. We continue to provide annual and very vital educational and personal support programs, and we have spread awareness of CF, but we haven't done enough on that part, and that's what we aim to do with Many Voices, One Voice. And why is it called Many Voices, One Voice? There are many of us across the nation, across the world, that have loved ones or have CF, that are healthcare professionals, that are involved in advocacy, all regarding cystic fibrosis. But there's not sometimes a lot of action that comes out of all the conversations between these groups. So CFRI would like to become that one voice that can take these issues and act and create some actions out of them, so that it's not just chatter, it's actually conversations with some specific output. And so we are going to rely on our partnerships with our collaborating agencies and with you in the CF community. So I always say, and people that know me hear this all the time, to know us is to love us. But you have to know us to love us. And how are you going to do that? By us spreading the word about CFRI, about cystic fibrosis, about all the issues that are impacting those living with this terrible, terrible disease. How can we do that? We can do it through advocacy, which is defined as the act or process of supporting a cause or proposal. And we have lots of that to do. And then there's a second component, awareness, knowing that something such as a situation, condition, or problem exists. So you combine the two of those together and you can have a very active, engaging, compelling, and productive campaign. So why would we want to do that? Why would we want to all of a sudden turn to many voices, one voice? Well, as I said before, CF is a rare disease. It impacts 200,000 or fewer people in the United States. That is the definition of a rare disease. And we all in the CF community know that in the United States, approximately 30,000 people have CF. Awareness is critical for the health and well-being of those diagnosed and impacted with this horrible, horrible disease. And we have to make sure that accurate and timely information is available to those who are in this situation, because those that are diagnosed or impacted with this disease have an even more difficult, traumatic, and stressful time if they don't receive information in a timely manner. And that, unfortunately, translates to health complications, and that's just not acceptable. And again, why do we want to do this? Because there is no cure for CF, and we have to do the best that we can do for those living with CF. So what is our focus going to be? Well, we're going to increase advocacy and public awareness efforts to promote treatment options, access to medications and insurance, increase CF research, continued development of medications, and to keep state-funded insurance programs accountable to federal drug access guidelines and other issues that will arise in the near future and in the coming years. Ultimately, what do we want to do? We want to provide a better quality of life to those diagnosed with cystic fibrosis. So some of the issues, and I'll just go over some of the top ones. There is often a long lag time between FDA approval and patient access to medication and treatment options. That's not acceptable because, as I've stated before, if you don't receive the medication in a timely manner, you're going to have some adverse health impacts, and we just can't have that. We need to have immediate access to vital FDA-approved drugs without lengthy waiting periods or increased clinic visits to monitor drug results. It's pure and simple. We need to ensure that the CF community's healthcare regimen is in the hands of the specialists and not decided by the government. They are not the physicians. We have excellent physicians, and we need to listen to them. So more specifically, I know it looks a little bit wordy, so I'll try to drill down a little bit. Several state-funded healthcare plans are trying to avoid the cost of life-saving CF medications by altering the FDA-approved guidelines for administering these drugs through their Medicaid-funded state insurance program. So what does that mean? Families that used to have access to medications are now forced to have long waiting periods before receiving approval, again, drastically impacting the patient's health. Can't have that. Some of the private insurance companies are now requiring a prior authorization process for CF medications that is contrary to FDA-approved guidelines, and they're also requiring it for medications that they have approved time and time again. So these may include time-consuming and costly pulmonary function and blood tests that are unreliable measures of effectiveness when conducted, yet may be grounds for denial. We can't have that, so we have to work together. Prior authorization is increasingly required for medications that are standard protocol for CF treatment, such as hypertonic saline, including less expensive therapies, and that keeps going on and on and on. So this process requires time on the part of both the patients and the healthcare team, and it disrupts the treatment adherence, and we don't want that. So again, many voices, one voice, we're going to be tackling things like this. Some of the immediate projects that we're working on, addressing national and state policy issues by working with decision makers and the public to effect change. And how are we going to do that? Some of you have already received our action alerts in the last 2 weeks. So we're going to be using action alerts that have letters embedded into them to send to your legislators and other policy decision makers on the issues that we've previously mentioned. We're establishing state-designated CF Awareness Months in May. Yes, May is considered a national CF Awareness Month, but each state does not have a state designation for it. So we've been working hard to get several states to do this. We're up to about 6 or 7 now, and California is next in line. Working with other CF patient advocacy groups and national rare disease organizations to strengthen our message regarding the CF community's needs. That's very important. We can take many voices and become one voice. How do we get the message out? Increased outreach via social media and other marketing channels. And that is the fun part. That's fun to do. So we have one upcoming project very near and dear to our heart, happens this coming Monday, CFRI Day at the state capitol in California. On Monday, May 16th, we have 9 CFRI friends. We have one-on-one meetings scheduled with various legislators to discuss cystic fibrosis, what our needs are, how they can help us, because it is a conversation. If they don't know about cystic fibrosis, if they don't know about the issues, they cannot help us. So we need to make the effort to go up and engage with the decision makers one-to-one. And I'm very grateful for our volunteers for coming and doing that with us on Monday. In addition to that, the Senate resolution, it will be brought to the floor. They will designate May as Cystic Fibrosis Awareness Month in California. So our group of advocates will be on the floor of the Senate as they vote on this resolution and designate May as CF Awareness Month. So we're very excited about this, and if there are those of you listening to us from home, or those of you in the audience, you live in California, you have time on Monday to take part in this, we would welcome you to come for the afternoon session where we're actually in the chambers. You'd be seated up in the seating area, but you would be recognized also when they present the resolution to CFRI and our group of advocates. So if you're interested in that, please call the front office or email us at cfri@cfri.org. So we're very, very excited. So, you know, we can't do it all alone. And it's that it does take a village, and we look to the CF community to be that village. So how can you help? You can become a CFRI ambassador. You can help us carry the message. You can help us decide what the issues are in your state that are problematic for those living with cystic fibrosis. We want to know what those issues are. So you can email me personally at suelandgraf@cfri.org with these issues, and you can join our efforts. Or if it's easier for you to remember, you can email me at cfri@cfri.org. But we want to spread our message, so please respond to our action alerts. We would really appreciate any involvement on your part. And now, something that we're truly excited about. As part of our advocacy campaign, we've developed a series of videos focusing on CF awareness so that we can present them through various social media outlets and marketing outreaches, presentations, so that people understand what CF is. The one that you're going to see tonight, it's the debut. It's featuring the music and lyrics of Matt Scales, a very, very talented musician. He unfortunately passed away from CF at age 27 in the year 2007. We're using his music. Thankfully, his family has said we may do that, so I'd like to thank the Scales family. And the video features members of our own CFRI community, and they all have CF. So before we begin, I'd like to thank you for tonight. Thank you for coming. Thank you for listening online. After the video, I'll be here to take some questions, and then Sherri Sager will take the stage. Thank you for tonight.
Through my eyes, I see it staring at me all the time. So I wish that it would leave my body.
Wish I could breathe like you are breathing. You know the answers out there. Won't you help me, please?
See, one day I breathe, I breathe, I breathe, I breathe like you. See, one day I breathe, I breathe, I breathe, I breathe like you.
I see the future. You seem so clear. One day I'll breathe like you.
And I think that I'm alright, but it keeps changing, like the weather.
It's not up to me how I feel, how I feel.
inside. Wish I could breathe like you, oh breathe. Know the answers out there, won't you help me please? The one day I breathe, I breathe, I breathe, I breathe like you. The one day I breathe, I breathe, I breathe, I breathe like you. I see the future, you seem so clear. One day I breathe like you.
Wish I could breathe like you, oh breathe. I know the answers out there, won't you help me please?
Just one day I breathe, I breathe, I breathe, I breathe like you. Then one day I breathe, I breathe, I breathe, I breathe like you. I see the future, you seem so clear. One day I breathe like you. Like you.
So there you have it, our first video, and I have to tell you, I get choked up every time I hear Matt Scale's song. It brings tears to my eyes, it makes me choke up. I do not want another family, another child, another adult to have to go through the pain of living with this disease. We want to find some results, whether it's a cure, better medications, but we can do it together. So thank you for watching online and being in the audience tonight. And I'm available for questions if you have any.
We do have one question We have a question from one of our online viewers. She says, just to clarify, when I send letters through your campaign, do I need to know who my elected officials are?
No, you don't need to know who your elected officials are. So we're using a new software. When we send our action alerts to you, there'll be a message in it. There will be a place for you to personalize the message, and there will be a place for you to put in your contact information. And that's the important part. We need your name, we need your city, your state, and your zip code, because that will then automatically link you to the proper legislators. And just so that you know, we don't share our donor list with anybody. But if we don't have your city, your state, and your zip code, we cannot match you with your legislators. So please, when you do receive the action alerts, be sure you fill all of that in. And I would urge you to personalize the story. There's an area for you to do that, and it's much more compelling to the legislators or the other policymakers who are receiving these action alerts to hear your story. Why is this important to you? Why is CF important to you? They want to know about it. It makes a big difference. So, good question. Are there any other questions? Okay, well, I would urge you to become involved. And if you don't think that we have your email address, please contact us at CFRI@CFRI.org and give us your name, your phone number, your email address, your city, state, zip code, everything, so we can put you in the system so that you can receive the action alerts. Because we want you to become one of the many voices that will eventually become one voice. So thank you very much for your time tonight. And now we're going to go on to the next part of our exciting program. I would like to welcome Sherri Sager to the podium. Sherri is the Chief Government Relations Officer at Lucile Packard Children's Hospital at Stanford and has extensive firsthand knowledge of the power of advocacy. Please help me welcome Sherri Sager.
Thanks, Sherri. Thank you, Sue. and thank you CFRI for inviting me here this evening. I got educated 10 years ago about CF and CFRI when I was asked to work on legislation in the state of California to expand the California newborn screening law to include CF. It was an incredible experience being able to work with all of the CFRI volunteers and staff as well as others. And it was also one of the easiest pieces of legislation I've ever worked on to get passed. It was really textbook. But we did all of the things that Sue talked about, and I'm going to talk about as well. We talked to legislators one-on-one. We talked with their staffs. We brought up CF patients and families to tell their stories. And it actually for me, the other big deal, and my staff hears about this all the time, is because we included not only CF biotinidase, and that was the big deal, is that I learned how to say biotinidase as well as learned what it was. So some of this will look a little familiar to what Sue just had up there, but I'm a strong proponent that if you haven't done this before, you can't hear about it and see it too often. So again, what is advocacy? Again, simply speaking, it's to speak in favor of. It's a person who supports or defends a cause, one who pleads in another's behalf. And all of you are advocates all of the time. We're just going to change who the audience is. Lobbying is to address or solicit members of a legislative body with the purpose to influence their votes. You have that power, and a grassroots organization can more than make up for folks on the other side. The principles of advocacy. Advocacy assumes that people have rights, and those rights are enforceable. Advocacy works best when it's focused on something specific. Sue's giving you some specifics to focus on. Advocacy is chiefly concerned with rights or benefits to which someone is already entitled. Getting access to the appropriate medications when you need it is a right and a benefit you're already entitled to. And policy advocacy in particular is concerned with ensuring that institutions work the way they should. We are that safeguard. The keys to effective legislation for children and families is that you need to bring a large number of individuals together. You need to get a large number of individuals within a legislator's district arguing for children, or you've got to have someone with clout lobbying for children. I took these two quotes from a report that's now 21 years old, and I looked to update it, and I thought, they're still as accurate today as they were 21 years ago. Most of the initiatives that a legislator has on children's issues have become because some individual with credibility came to them directly, someone they knew and trusted. Some of you who may be from the Bay Area may remember former state legislator Ted Lempert. Ted is now the CEO of an organization called Children's Now. And what he told us years ago when we were putting together an advocacy group for children was, children's advocates are too nice. You'll go in and you'll say, here's our issue, and the legislator will say, oh, that's a really important issue, but the seniors have this issue and they're not getting this, and children's advocates always say, oh, yeah, that's true. Well, sometimes that happens with disease-based organizations as well, because you're compassionate by nature, you're empathetic, you understand, oh, others are having problems. What Ted said to us then is, if you want to be successful, your number one priority needs to be children, your number two priority needs to be children, your number three priority needs to be children, because the other side is doing that and you need to do it as well. So what is public policy? It's authoritative decisions by a legislative, executive, or judicial branches of government. And though we're going to talk mostly about legislative, please don't forget about the executive or judicial branch, because we can oftentimes get legislation passed that we want, but then the executive branch doesn't always implement it the way we believe it ought to be implemented. They're authoritative decisions that are intended to direct or influence actions, behaviors, or decisions of others. It's a process used by society to make decisions about programs, choose goals and strategies to achieve, to manage conflicting views, and to allocate resources. We have to give legislators a reason to vote for us. We have to give them a reason to be positive, to step out of their comfort zone, to feel like they know what they're talking about and that they have the confidence. Health policy is a form of public policy. Often it's formulated nationally, but it's applied locally. It involves interpretation of diverse realities, an aggregate of individual understandings and beliefs about the future. Now, if you're from here locally, I usually say I fully understand that California is not necessarily like any other state in the union when I talk to my colleagues across the country. I also know that the Bay Area isn't like the rest of California. And I would go so far as to say as Silicon Valley isn't even like the rest of the Bay Area. So that means we have lots of diverse realities, and in order to be successful, we have to understand them and move forward with our policies, with our message, but taking those into account so we can be responsive. I'm going to do a really quick overview of policy as a process, how government policies, the 4 stages of decision making, from the agenda setting, which is identifying a social problem, which Sue has, in terms of not enough money for research into CF, changes because of other laws in terms of access to medication. Years ago, it was the newborn screening, where we were able to demonstrate that getting a child screened at birth meant we could get them on treatment sooner. They would have a much higher quality of life, and surprise, surprise, we could save the government money as well. We have to bring it to the government's attention. I was talking to Sue before this about an administrator from the state government who was interviewed on camera and said, gee, no one's sent us any complaints. We didn't know there was an issue or a problem. And you're like, wait a minute. So it means we haven't done a good enough job making sure that they're aware that there's a problem. Legislation and regulation. So that's a formal response to a problem. And I'm going to use tonight as an example legislation that's pending on the national level called ACE Kids. It stands for Access to Care for Exceptional Kids. The focus of ACE Kids is to recognize that children who are covered by Medicaid and have complex health care conditions often need to cross state lines to get the care that they need. That there are not pediatric specialists in every state or in every region of the country. And we need to find a way to make it simpler, because unlike Medicare, Medicaid is 52 different programs with a federal umbrella, but it doesn't guarantee access. This legislation would designate a national network, would designate a federally designated national network of care for children with complex health care needs. Each network would be anchored by a children's hospital. And you say, well, why does it have to be a children's hospital or a large pediatric program? Because what we know is we're interested in improving quality of care. Sometimes the government is interested in that, but they're also interested in saving money in the healthcare system. And the most expensive piece of the healthcare system is inpatient hospital stays. So if we can develop a system that helps children not have to be hospitalized, then we can achieve both higher quality as well as lower costs. So these networks of care include community hospitals, primary care physicians, community clinics, family resource centers, programs like CFRI. It's our village. It's creating that village. And you can be part of more than one network. So one of those issues that we have at Packard is we do a lot of pediatric transplants. The state of Oregon doesn't cover pediatric transplants in state with their Medicaid program. So children from Oregon who need to have a transplant tend to come south to Packard or north to Seattle Children's. Well, that's fine if everything worked on a nice Monday through Friday 8 to 5 schedule. But what happens if a child all of a sudden goes down and an organ is found and it's 5 o'clock on a Friday night and there's no one there to approve the authorization? How do you handle it? Well, we choose to take care of the child. But that also means we're in danger of not being reimbursed for the care. That's not a sustainable system. So if we could create a network that includes the hospital in Oregon, we can then become an in-network provider. We can have different kinds of contractual arrangements. Now, that's a problem for us here, but imagine if you're on the East Coast where the states are small and they're right on top of each other. The Children's Hospital in DC, a third of their patients or more come from Virginia, a third of their patients or more come from Maryland. They're dealing with 2 different state governments. They're dealing with the federal government for the District of Columbia. All have different rules. How do we make this more transparent? And at the end of the day, easier for families to get their child to the right place at the right time with the right provider. That's what ACE Kids is about. Implementation, execution to achieve goals, and then do an evaluation. Appraisal of the policy performance. How many times have I heard that the states put in a program, but they don't really know whether it's working because they cut out all the money for the evaluation, but they're moving forward with spreading it out and disseminating it and having it become the new rule, not knowing whether or not it really works. Parents and advocates' involvement in policy. Public health policy, it's a vehicle for creating healthy environments, for improving the health of individuals and communities. And through public policy, government plays a key role in healthcare. And being informed and involved helps to prevent marginalization and invisibility. Now, some of those wonderful kids that we saw in that video, at first glance, look perfectly fine. How would you know they have CF? And so if we aren't talking about it, if they aren't sharing their stories, if they aren't educating not only legislators, but legislators' staff and the administration. So one of those questions I want you to think about and think about your own life is, what opportunities have you had to influence public policy? And look at that. The next question is easy to answer because Sue's already answered it for you. What are efforts you can make now and in the future? And you can get involved in the grassroots advocacy. You can send letters. You can attend meetings. You can make your voice heard. So again, what is advocacy? Advocacy is a mindset. Advocates see opportunities when others only see obstacles. And they work to change the institutions causing problems for everyone. Though I might get frustrated sometimes because government works too slow, I see it as a chance to educate them and to make a difference in the lives of children and their families. That's what it's all about for me. How do we make a difference? How do we improve the quality of care? But more importantly, how do we improve the quality of life for our children and our families? This is an important one. This goes back to Ted Lempert, that children need to be, or in this case CFRI, needs to be your top 3 priorities. The object of lobbying is not to be liked, but to be respected and listened to by providing information and education, and as one of my staff reminded me, accurate information and education. The number of voters you can influence. So if you have an organization of 3,000 people, you can theoretically influence 3,000 voters. Don't be afraid to use the media to tell your story. And these days, we have even more access through social media and just talking. I'm doing a conference with one of my colleagues from the Adolescent and Child Psych Department at Stanford School of Medicine on mental health in August. We're talking about prevention of adolescent suicide, but more importantly, how to reduce mental health stigma. And we've been talking about this for a year, doing the planning, and every time I talk to somebody about the conference, they tell me a story in their family or their extended family of someone who's had a mental health issue, but they've never talked about it before. We need to talk. We need to make our stories known. We need to make them visible. Otherwise, we remain invisible. So who is a policy advocate? It could be siblings and friends, patients, parents. Any of us could be a policy advocate. You just have to be willing to speak up, help others get benefits to which they are entitled, challenge government systems when they don't work, work for laws, budgets, and policies that do work, and be willing to be a voice for others. So again, advocacy just means speaking up. Learn to think in terms of 50% plus one. For most pieces of legislation, you only need 50% plus one to get it passed. To get elected to office, if there are 200 voters in the district, you need 101 votes. 50% plus one. Always keep three audiences in mind: the elected officials, their staff, other voters, and the media. The media can be your friend. When we were doing the newborn screening bill, we just happened to have a news reporter that wanted to do a story on cystic fibrosis. We told him about the legislation we were sponsoring and working. He said, let me know when you're going to have your hearing. I'll make sure that it airs right before your hearing, and then you can reference the news article. We did that. It was great. Make sure the people you're talking to actually hear you. And always keep the door open for next time. You might not get everything that you hoped for or wanted that first time, but if you keep the door open, sooner or later, you're going to get something. There are multiple ways to create and shape public policy. Legislative action, communicate with your elected officials. Again, Sue's just given you a great opportunity and a way to do that. Know the relevant regulations. Interact with the regulatory agencies and officials. While we were doing the legislation on the newborn screening, we were talking to the Department of Health Services at the same time, and they couldn't wait till we got the legislation so they could start working on the implementing regulations. I think it's the only time in my career where a state agency actually had the regulations ready and done before the deadline. They were so anxious, but we kept them apprised all along the way so they knew what was coming, they knew to prepare for it, and they were doing their homework. Keep in touch with them. You know, you could provide campaign assistance. Everybody who's running for office needs campaign assistance. Develop support, health agendas. Again, I've talked about ACE Kids, CF, newborn screening. If you're in California, the CCS program, that the state government wants to move into Medi-Cal managed care. They have some really good reasons. I think we have equally good reasons on the other side to say, no, actually the CCS, which stands for the California Children's Services, is actually its own Medi-Cal managed care program. And we think rather than just moving it into a system where the children with the most complex health care conditions become a very small percentage of the overall membership, that we just improve the existing system and we can make it better for everyone. Participate in public service. For a legislator or their staff to see you out and about in another setting, always helpful. So how to be an effective advocate. Educate yourself about the legislative process. And I'm going to do this really quickly. I've picked on California, but it's pretty close to this in almost every state. Bill gets introduced. Hearings are held in the policy committee. If there's a financial impact, if you're in California, it's referred to the Appropriations Committee. Then it eventually moves to the floor for a vote. If it passes, it's referred to the other house in all states, but I'm going to go blank now, and I shouldn't. I think it's Nebraska that has a unicameral. Everybody else has a two-house and state. And it gets assigned to a committee. Hearings are held again, moves to the floor, must be passed in the session or it dies and has to be reintroduced, sent to the governor's office. Governor signs, hopefully. And the implementation in California is usually January 1 of the following year, unless it was an urgent bill that had to get passed by 2/3, and then it can go into effect much sooner. People hear about lobbying and they think, oh, I can't do that. That's too hard. I can't do that. Lobbying's easy. First, develop a clear, simple message. A problem to call attention to. A useful personal experience, a proposal that you'd like to see enacted or rejected. You can do this in 2 minutes or less. We have a problem with children with complex health care needs can't always get to an appropriate pediatric provider in a timely way because they have to cross state lines. We have examples of children, and we can give you all these examples of people, and you can give your personal example. Here's a piece of legislation that we believe would help these children to get to the right place at the right time, get a higher quality of care, and oh, by the way, can save the government money. How to be an effective advocate? You're educating those elected officials and those community leaders. Get others to support your position. Advocate on your behalf. I've been working on this particular piece of legislation for 2 years now, which on the federal scheme of things isn't that long. But I've gotten adult hospitals to send letters of support. I've gotten business organizations like the Silicon Valley Leadership Group to take a support position and send in letters of support because they recognize how it all ties in to what they're trying to do and create a healthier community. Get others to support your position. Best way to, personal lobbying is one of the best ways to be effective in the political arena. 2 minutes with an elected official. You can get 2 minutes almost anywhere. I've been known to see an elected official on a plane, and I'll go up and I'll say, okay, first thing I always do is I thank them for their service, and then I say, I know you're busy and I don't want to take your time, but I just need to introduce myself. I'm Sherri Sager, the Chief Government Relations Officer for Lucile Packard Children's Hospital, and I'm working on some legislation to make it easier for children on Medicaid to get to the right place at the right time. Can I come in and meet with you? That's it. That's my elevator pitch. 2 minutes. They're going to remember it. They tell me who to contact in their office. I had a chance to be at a breakfast last week with Congresswoman Loretta Sanchez, who's running for U.S. Senate. This was a policy lunch breakfast. It had nothing to do with her campaign. I gave her my 2-minute pitch. She's from Southern California. I then emailed my colleague down there and I said, Jenna, I just gave a quick overview to Congresswoman Sanchez on this bill. I think you should follow up with her. And then I sent the same email to my lobbyists in D.C. and said, I've asked Children's Hospital Orange County to follow up, but why don't we follow up as well? Didn't take much longer than 5 minutes. How to be an effective advocate. Be knowledgeable about your subject. All of you are the best advocates. You are so knowledgeable about your subject. Be organized and prepared. Make the best use of your limited time. If you're going in with a group on Monday, know who's going to say what. Make sure you know what the key points are. Be concise and clear. Officials and their staff deal daily with issues as wide-ranging and complex as healthcare to telecommunications, on the federal level to foreign policy. You have to avoid overly complex healthcare jargon or abbreviations. Otherwise, you'll lose them. So no jargons, because even in our own world, what I mean by care management, trust me, is not what the state means when they say care management. I'm talking about our case managers, our social workers, the networks we have, giving families the support that they need. and the state says, oh, care management, we can have the managed care plans do that for you. Take all that worry off of your plate. Families don't really think that that's what will happen. Stay on the message. You will likely only have a limited time to make your points. And if you don't stay on message, it's way too easy to become sidetracked and discuss unrelated topics. So Sue, how are you doing? You know, I saw you at the grocery store last week, and it was really great. What's happening? Are you keeping busy? How's your mom doing? It's that easy to get distracted. And all of a sudden, gee, I'm sorry, my next meeting's here. And you haven't been able to make your point. And then be clear, what exactly do you want the legislator to do? So I want the legislator in Congress to become a co-sponsor of my ACE for Kids Act, my Access to Care for Children with Exceptional Needs. I have 203 bipartisan co-sponsors as of today. I want to get up to that magic number of 218, which means I have more than half of the Congress signed on, and then there's no excuse for leadership not holding a hearing because more than half the members have said they want to move this bill forward. Make sure you convey that. What's that desire? Sometimes it's, I'll go up to our local congresswoman who's strongly supportive and I'll say, can you talk to your colleague? Can you urge them to hold a hearing? Can you see, haven't been able to get them on the bill yet. Can you see if you can get them on the bill? Give them something to do. Ask them to vote yes or no on the bill. Champion your cause. Say, do you need me to do something for you? Is there somebody you want me to go talk to? Our congresswoman one time said, I want you to go talk to the chair of the committee. He's from Texas. And I said, we're not really from Texas. And protocol, and I have colleagues in Texas. I'll have the Texas Children's Hospitals go talk to them. She looked at me and she said, no, I want you and your CEO to go talk with them. The others can come along, but I want, yes, ma'am. We went and talked to them. Be relevant. Ensure that the official and staff understand how the policy being discussed has real implication to your cause and the health care of patients in his or her district. They may not realize how many CF patients they have in their district. You can let them know. And you can tell them that not having access in a timely manner to the appropriate pharmaceuticals makes a difference in the quality of life for that child, that adult. That's in their district. Supply statistics, because they like the objective, but give those real life examples. Tell your story. And when somebody says to you, oh, please don't bring in any more families on this issue, it means you're doing the right thing. You're making them feel uncomfortable and that they're going to have to do something. Do it. But listen, be ready to discuss. They may have an opposing view or they might have another option you haven't thought of. Listen to your officials' concerns and opinions. Attempt to address them and find some common ground. They may be opposed to helping you with the issue in question due to some other political consideration. Find out what that is. Then maybe you can go talk to that other group, talk to them. Sometimes it's because we want something to be mandatory and they're like, oh, I'm not really comfortable with mandatory. But if you change it to discretionary, you've got my vote. Usually doable. Attempt to find another vehicle or another option that would allow them to help with your issue. There's always more than one way to do this. Again, but if you can't find common ground, explore other issues that maybe they can't help you in this, but they can help you in something else. Years ago, I was working for a state legislator who was out on a medical leave, and it was time to get all of his legislation passed. And he had some legislation on peace proposals, and he had one in particular on self-esteem. And I had state senators say, who would never have voted for his peace proposals the year before. He said, oh, Sherri, I can't give you a vote on self-esteem. I'll be laughed out of my district, but I'll give you a vote on the peace package. I got the peace package through. They got the self-esteem bill through the next year. You're a constituent, and they'll often go out of their way to help you on another issue, especially if they've opposed you on a prior issue. They want to find a way to work with you and to keep you happy. Wrap up the meeting effectively. summarize what you've discussed, because you want to make sure everybody is aware of what the results are. You recap this. This is what I'm asking you, and here's my one-pager that gives you all of the information, and here's my contact information. Ask them when and how you should follow up. Okay, so should I follow up with Sue next week? I'll give her a call. Contacting your legislators, we've talked about that. Write, call, visit, email, fax. See them in person. Be brief. Never threaten. Identify yourself and how you will be affected by what is proposed. Be clear about what you want. Mention provisions that you agree and disagree with, and if possible, offer some alternatives. Let them know how they can contact you. After the visit, follow up with a thank you note and continue to follow the issue until resolved. And I don't know how much time I have. Okay. So some other ways to shape public policy, ways to be involved. Marketing and media. Hold a press conference. This is a press conference in front of the hospital with Congresswoman Anna Eshoo, where we're announcing a big grant from the March of Dimes. Write an editorial or talk to the editorial staff at the local newspaper, whether it's an alternative newspaper or the big daily. Help them to have the information so that they could write the editorial. Become part of a speakers bureau. Service clubs like Rotary Club, Kiwanis are always looking for speakers. Write an op-ed. You can write an opinion editorial, giving out all the information. Look at ways to be involved in public service. Become aware of the opportunities. A lot of legislators these days have youth advisory groups. So if you're a young person and you want to call their office up, see about becoming an intern or a volunteer or part of their youth advisory group. Understand the politics. When you actually are in an elected official's office and they're not campaigning, they serve everyone. They don't care what your political views are or your background. What they care about is that you're there for a purpose, to work, to get something passed. Involvement often naturally leads to public service in some way. Consider public service yourself through appointment or an election. Some of our best supporters are families or legislators who've had a child that's had a complex health care issue, disease, diagnosis. They understand how important it is to make sure that they've gotten their child to the right place. And I've had several of them say, you know what, every family should have the same opportunities I have. I have private insurance, but even if they don't, everyone should have that same opportunity. It's real. If you're comfortable with doing political campaigning, they always need volunteers. They always want signs in their yards and in people's yards and stuffing envelopes and mail. Answer the phones, hold a neighborhood coffee, walk precincts, generate money for the candidate. I have to tell you, my favorite job in a political campaign office was actually sitting at a table, stuffing envelopes and listening to the other volunteers and hearing why they were supporting this candidate. I learned a whole lot more than I would have if, as one of my interns used to say, oh, I want to be important. I want to do something important. I want to do strategy. It's like, everybody can do strategy. It's really, what are the issues? Action plans. Vote. Register to vote. Influence voters if you're not eligible to vote. I got my parents to vote for a candidate I'd heard speak because I'd heard them speak long before I was eligible to vote. And if you're eligible to vote, cast your vote. Don't be afraid of lobbying appointed and elected officials. Send letters, emails, make phone calls. Attend town meetings. I went to a town hall meeting years ago for a member of Congress, and he was mostly talking about Social Security. And when I raised my hand and got called on, I said, I just want to thank you for your support of children's issues and children's health. He never forgot that. He was there the next time I needed a co-sponsor in a bill. Make appointments to meet them. And nowadays, we have social media. Use social media, but use it in a positive manner. Even if you're really upset with that elected official, turn it around. Turn it into an action of, we need to get more information to this elected official to explain how this works. We only had a short period of time. We didn't have enough time. Don't say, oh, I'm never going to vote for this legislator again. He just doesn't get it. She just, went out of her way. remember, what's out there on social media never goes away. So always make it positive. Here's just some information, places you can access information besides newspapers and journals, the internet. The first one, thomas.loc.gov, that's the legislative process in Congress. If you're local, the California Healthcare Foundation puts out a daily briefing called californiahealthline.org. Few pages, overview of what's happening in the state. And if you want to know how much money people are getting through campaigns, opensecrets.org. What legislators are saying, politics belong to the persistent. So thank you, and I'm happy to answer any questions.
Thank you, Sherri. We have several questions from our online viewers. The first question, how much time is a nonprofit organization allowed to spend on lobbying activities based on the 501c3 status?
They can spend up to 10% of their budget and 10% of their time. Which is actually a lot when you add it all up. What they cannot do, they cannot get involved in a political campaign. They cannot support or endorse candidates, but they can get involved in issues.
What is the most rewarding experience you have had, either as an advocate or that you have witnessed?
Well, based on who my audience is today, I'm going to say my most rewarding experience was within 6 months of when 2 physicians came in to me and said, Sherri, we need to get cystic fibrosis added to the newborn screening panel. And we got it passed through the state legislature and signed by the governor. We had it going both the policy track and the budget track. And former Governor Schwarzenegger, when he signed the budget, actually singled out the newborn screening for CF as one of his highlights of the budget. And then the fact that the state implemented it the following month, 11 months later rather than 12 months, was awesome.
We have another question. Who do you feel are the most responsive elected officials, local, state, or federal?
That one's harder to answer because it depends on relationships you've built with them. So all of the ones locally here in Palo Alto and Santa Clara County, Silicon Valley, I have relationships with. So I would say they're all responsive. Do they all do what I want them to do every time? No. But will they all talk to me when I need to talk? Will they explain, if they can't support a position that we're advocating, why they won't support it? They do. I feel pretty biased, and one of the things that I think my colleagues across the country get tired of hearing me say is that I think in Congress, I think we have the best delegation in the Bay Area, bar anywhere. Every one of our folks listens. Again, they can't always do what we need them to do because of other things, but if they don't do it the first time, they'll come back. But they get it, and they're empathetic, and they're compassionate, and it's just like, well, of course this needs to be done. Taking care of children, taking care of folks who have a complex health care condition. So it really is about building personal relationships.
Okay, this person realizes you touched on this topic a little, but he asked, if I try to meet with an elected official and instead am told I will meet with the aide, should I feel discouraged?
No.
Does this mean the elected official does not want to hear about my issue?
No. And as a former staffer, I can definitely tell you, talking to a staffer is always as good and sometimes even better, because you're going to talk to a staffer whose focus is in your area, who's a healthcare staffer. And so they're going to ask some of those deeper questions. They know what it is their boss is looking for, and they're going to become your advocate. So talking to staff is great. And then at some point you'll get into the legislator, but for example, try to get in to meet with Minority Leader Nancy Pelosi or Majority Leader Kevin McCarthy, it's almost impossible. They're answering to everyone. Or even U.S. Senators Boxer and Feinstein, they have a state of 40 million people. We meet with their staff all the time. Their staff are great. And they're the ones who are doing all the work behind scenes. They're telling us who else to talk with. And then on occasion we get to meet with a member. But the staff are great. So do not feel discouraged. And sometimes it's even better.
While this is going out to the nation, I do want to ask one California-specific question, and it's really for all the families with CF who are receiving care through CCS. And I am concerned that families aren't knowing what's going on with this, and I'm just wonder if you could briefly say what could possibly happen with the shift to this managed care for a family with CF, and what those families, if they have concerns, could be doing to have their voices be heard.
Great question, and thank you. So the state has been trying for a number of years to move CCS, which has been carved out, into Medi-Cal managed care. They're now down to, can we just move it into those plans that are county organized health systems where they're partial? And so they haven't, they've only done it so far in one county, which is San Mateo. There's no evaluations yet of whether it's working, how it's working. And one of the things that as advocates we aren't very good at, and we aren't very good as a hospital, is documenting. We always find ways to find workarounds. So we're now into, okay, we need to document when the system isn't working, rather than, we may still have to find a workaround for now, but we need to let the health plan know this isn't working. And do it in a way that's respectful and doesn't disrupt, good relationships we have. There's a coalition, and I was mentioning to Sue, of about 40 organizations, and I'm going to put Sue in touch with them, that have been working together to draft a piece of legislation that would be that consensus on how can we maintain the principles of CCS, which means guaranteeing that kids get to be seen by a pediatric expert and a panel provider in a appropriate facility, while still meeting some of these other criteria that the state has. We're hopeful that will have a hearing sometime in the next few weeks. So we will put Sue in touch. We haven't started out with a grassroots campaign yet. If the Department of Healthcare Services agrees to the legislation, then we might not need to do a strong grassroots campaign, other than to say thank you, which is as important for those legislators. So I'm going to put Sue in touch, and so more to come on that. Any other questions? If not, thank you all very much. And I just want to give all of you a word of encouragement. Keep up what you're doing. You are the best advocates. I get to be an advocate because sometimes you're overwhelmed with taking care of your children, taking care of yourself, and that's important. So tell me your stories. I'm really good about sharing stories and making sure that other people understand the issues, what you're going through, what's important, what needs to be done. But thank you for all that you do on a daily basis.
That was wonderful.
Thank you, and I need to sign.
I'll tell you, Sherri's become one of my new best friends. Truly, we're going to be in touch a lot. I sat there, I'm so energized by what you said, because I can't stress enough, and Sherri was stressing it, advocacy is really important. We have the ability to make a difference. And if there's a cause that you care about, and for those of you who are listening at home and here in the audience, you care about CF, work with us and become part of our ambassadors. Work with Sherri on some of the things that she's working on, but together we can make a big difference, and it's very, very powerful. So I'm super excited. I'm going to go home tonight, not sleep, come up with lots of ideas for my office tomorrow, and we'll go on from there. But it truly is exciting. I see Siri sitting over here smiling. She'll be joining me. We'll be emailing late at night tonight. I know it. So thank you, Sherri, very much. We really do appreciate it. And thanks to everyone online here in the office for joining us this evening. Special appreciation once again to our sponsors, Vertex Pharmaceuticals, Genentech, and Chiesa USA for sponsoring tonight's Discovery Series. And believe it or not, it is true, this is our last CF Discovery Series for a while. We always take a summer break, and our next Discovery series will be on Tuesday, September 13th. But before we end, I want to encourage all of you to go to CFRI's website to see the programs that we have ongoing throughout the summer. We don't want you to miss any of them, including our online MBSR classes for those with CF, our financial support for individuals with CF and their caregivers, for counseling sessions, and we have a monthly support group for CF caregivers that meets here in the office, and we also have a retreat for adults with CF, and that happens this summer. And, of course, it wouldn't be a message about our programs without mentioning our annual national conference. The CF conference takes place at the end of July, July 29th through the 31st. And we have an incredible lineup of educational presenters as well as a separate track for our CFRI-funded CF researchers. Strongly encourage you to go online to our website and register for that. It will be sold out. It's an incredible opportunity to learn more about CF, to learn what's happening, and also maybe how you can get involved. So please, thank you very much for your time tonight. I encourage you all to stay tuned for more. We have many voices, one voice. We're going to be turning to you. We want your support. We want your ideas. We can work together. We can work with Sherri. We can accomplish great things together. So thank you very much for your time tonight. Good night.